Recently, President Donald Trump held a press conference at the White House alongside Oracle's co-founder and CTO, Larry Ellison, to announce Project Stargate. This project involves an AI-powered personalized mRNA cancer vaccine. Here's how it's supposed to work. AI will analyze a patient's blood samples to detect cancer and then design a custom mRNA vaccine for that individual. Ellison stated, quote, "Then beyond that, once we gene sequence that cancer tumor, you can then vaccinate that person, design a vaccine for every individual person to vaccinate them against that cancer. And you can make that vaccine, that mRNA vaccine, you can make that robotically again using AI in about 48 hours, end quote. However, this initiative should alarm Americans for several reasons. First, Ellison's claim that an mRNA vaccine can be custom designed for each person seems highly questionable. Cancer varies widely between individuals, making true personalization extremely complex. Dr. Robert Malone has highlighted that each person's immune system and genetic profile are unique, and every cancer has its own distinct properties, such as growth rate or the ability to spread to other parts of the body. Thus, this would require an extensive individualized process for effective, safe vaccines, which the pharmaceutical industry isn't currently set up to manage. Vaccine makers already fail to test vaccines in placebo-controlled trials before they are licensed. They already fail to personalize their products to avoid vaccine injuries in susceptible individuals. How can each vaccine be adequately tested for each patient? Big Pharma does not have a good safety record as far as this is concerned. Second, AI's role in medical decisions will be the final nail in the coffin of the doctor-patient relationship. With healthcare costs soaring to 26% of the federal budget and 20% of GDP overall, there's a massive financial incentive for pushing big pharma products. The unbiased doctor-patient relationship is the patient's last hope for making the best medical decision for themselves. These huge financial interests will obliterate this. Doctors who aim to act ethically and independently will not be tolerated. Third, these AI-generated cancer vaccines would simply be one more product to serve the financial interests of big pharma. Vaccines are the number one product that big pharma sells. This is because they enjoy unique legal protections, making them extremely profitable for pharmaceutical companies. Unlike medical treatments, they are shielded from liability lawsuits. If you've wondered why vaccines are all the rage, this is why. By law, they don't have to be as safe as their other products. The horrific path forward could then be to produce vaccines over treatments and make them just good enough so that people don't quickly organize against side effects. The medical industrial complex runs the federal government, not the other way around. This is why Robert Kennedy Jr.'s confirmation hearing was so hostile. The opposition is bipartisan. Tech giants like Google, Microsoft, and Oracle, led by Larry Ellison, are heavily involved in healthcare. They provide services from electronic health records to insurance billing and data gathering. Their involvement has led to a 35% administrative waste in the system, which has not contributed to making Americans healthier, but rather is money taken away from doctors, nurses, and hospitals, diverted to bureaucrats and shareholders. This is exactly why the public continues to grow frustrated with the system. The data they manage can easily be centralized, and there have been numerous security breaches showing it is not secure. Their software compels doctors to deal with the manufactured racism of DEI queries while engaging in unnecessary documentation and the practice of protocolized medicine. And when these companies can sell a new, profitable product, like an AI-generated mRNA vaccine at the end of each medical visit, it completes their control over the healthcare encounter. Fourth, a marriage between big pharma and big tech would exponentially empower the medical industrial complex. Once AI dictates treatments based on proprietary corporate algorithms, the power of an individual doctor and the concern for an individual patient will cease to matter. Medical autonomy will be lost. Then it will be scorned. And finally, it will be outlawed. Anyone who questions the AI's conclusions will be dismissed as anti-science. Doctors who dare challenge these AI treatments will be labeled misinformation spreaders. And patients who seek second opinions will be labeled anti-vaxxers or anti-AIers. Those who choose a wellness lifestyle free from big pharma will at best become outcasts and at worst, during times of stress, as we saw during COVID, actual outlaws. The doctor-patient relationship becomes obsolete. The totalitarian danger of an AI-controlled medical industrial complex is particularly acute with Larry Ellison in charge. He has openly supported using AI for surveillance, stating, "Citizens will be on their best behavior because we're constantly recording and reporting everything that's going on." Imagine combining this surveillance approach with AI-designed vaccines backed by the power and purse of the federal government. This would lead to a controlling biosecurity state where medical data, behavior, and AI tracking merge into one all-encompassing omnipresent system. Who will provide the necessary oversight to prevent this? Can we trust the federal government to rein itself in? I'm grateful that Trump is in office rather than an administration eager to enforce AI medicine. While I doubt Trump would make these compulsory, his Operation Warp Speed did pave the way for vaccine mandates under Biden. It's our responsibility to challenge dangerous policies regardless of who promotes them. The issue with AI in medicine isn't about opposing new technology, but protecting ethical healthcare practices. We need to guarantee that patients are not coerced into treatments against their personal desires and that doctors remain free to exercise their professional judgment. Patients benefit when healthcare choices are facilitated by those who have sworn an oath to do no harm, not by those who seek to turn healthcare into the next frontier of big tech domination. I'm calling on President Trump to reconsider this venture, and I hope the American people will oppose it. The last 4 years revealed to us the tyranny and corruption of the medical industrial complex, but also strengthened our resilience, our indomitable American spirit. We've battled the alliance of big tech, big pharma, and big government, and we prevailed. Now it's time for we the people to rise to the challenge once again. I'm Dr. Simone Gold. Thank you for listening.